Hi, my name's Kate. I'll be your nurse today. What's your name? Nice to meet you. And who is this with you today? Mom? Alright. And I also see you have a little friend here. What's his name? Bear? Alright. Well, Bear's going to help us out today, okay? If you're feeling scared or you want me to do any assessment on Bear first, you just let me know, okay? And Mom, he can also sit in your lap if you'd like. Alright. And Mom, can I just verify his name and date of birth with you? Right. And then any allergies? Alright. Well, today we're just going to be doing an assessment on him. I'm just going to make sure you're doing alright, okay? Alright, so while I'm getting my gloves on and while I'm talking to Mom, I'm going to be just assessing his respirations, looking at his chest, and counting breaths per minute, okay? And for a 2-year-old, that should be around 22 to 37 breaths a minute, okay? Alright, I'm gonna get some quick vitals on you. So I'm gonna be doing a temperature in his armpit, and normal temperature should be around 36 degrees Celsius for this age group. Alright, and then I'm going to be getting a heart rate, so I'm going to listen at the apical pulse. Alright, so I would listen for 1 full minute, and this should be around like 96 to 140, 150 beats per minute, okay? And then I'm going to get a blood pressure, alright? So it's just going to give you a tight squeeze first, but then it's going to be over in a bit, okay? Alright, so I would use a age-appropriate blood pressure cuff, and then I would get that blood pressure, and that would be around systolic 86 to 106 in that range, and then diastolic we would want like 42 to 63. Alright, awesome. Now I'm going to put on a pulse ox. This is going to tell us how well he's oxygenating. And I am going to either put this on his hand or toe. And Mom, if you have any questions or anything during this, you let me know. And also, if you have any questions, okay? Alright, I'll get that pulse ox going. Awesome. And now I am going to do an EKG. This is just going to tell me how well your heart is working, how those beats are sounding, anything like that, okay? So I'm going to take this off for you. Okay. So I'm going to do snow over grass, and I would do smoke over fire. Alright, I will plug that in a machine. That would give me my results. You're doing a great job, okay? Alright. And then just talking about diapers and normal input and output, Mom. So for his age, a normal input should be about 120 to 150 milligrams per kilogram a day, and then output we should be having about 1 to 3 milliliters per kilogram an hour. So in simpler terms, this would be about 6 wet diapers a day, okay? Are you having any concerns with anything like that? No. Alright. So I'm going to go into my assessment, and first thing I'm going to do is I'm just going to assess his overall color, legs. Alright. And then I am just going to start at the head, okay? So I'm going to shine a big bright light in your face, okay? I mean in your eyes. So, ready? Okay. All right, and they are reactive to light and equal. And then I'm going to look in your mouth, all right? I'm just gonna look at that mucosa and make sure it's pink and moist. And can you show me your teeth? Smile for me. Awesome. All right, and then I'm also going to just look at your face symmetry, make sure the ears, nose, eyes, everything looks symmetrical, which it does. And the fontanelles do close, anterior fontanelle should be closed by 18 months. So for a 2-year-old, that should already be closed. But I'm just gonna assess that and make sure that it is closed. All right, and for an infant, we would be doing assessing fontanelles and reflexes. All right, so now I'm gonna give you a listen, okay? All right. So I just want you to take some big, deep breaths for me, okay? All right, on the front, all the lung sounds sound clear. And I would just also look for the work of breathing. I don't see any retractions, any accessory muscle use, nasal flaring, so that's awesome. Then I could also have mom help me, and I'm just going to listen to his backloading sounds.
You messed up the last part with the order.
Alright, awesome. Okay, and then I'm going to listen to your heart, okay? So I'm going to listen at the apical pulse for 1 full minute. Alright, and I hear S1, S2, normal beats. Awesome. All right, and now I'm gonna move down to your abdomen, okay? So I'm just gonna listen. And mom, when was the last bowel movement? All right, passing gas. All right, and take another listen, okay? Hang in there. All right, all the bowel sounds are active. And now I am going to just assess your tummy. I'm just gonna lightly touch them, touch your tummy, and if you feel any tenderness or anything, you let me know, okay? All good? Awesome. All right, so now I'm going to assess your arms and legs. So I can do your arms first. I am just looking at the overall color, looking for any edema. Look at the capillary fill, less than 2 or 3 seconds. Good, feeling if there's any warmth.
So I'm just gonna.
Right, and then I'm just going to listen to the pulse. I can do it in the radial, or if I can't feel it very well there, I can also do it in the radial. Right.
Just you have to keep my whole body.
I would do that bilaterally. And one thing I also need to do is the skin turgor. So I'm going to, just going to feel a little pinch, but it's going to be very light, okay? Just behind your tummy, all right? And that's just going to tell me how much water you're drinking, all right?
Yeah.
All right. Looks good. Okay, now after I did those arms, I'm going to move down to the legs. I'll pull these little PJs up. Alright, so I'm just going to assess the color, assess for any edema, feel warmth, pulses. check refill.
Everything's all messed up. I really thought I did it right. I really clapped. I was like,
Alright. Everything looks good. And while I'm assessing, I would just assess his GCS, which just shows or tells us how well he's like following commands, speaking appropriately, responds well, and I can assess that while I'm talking to him. Alright, doing a great job. Almost done.
she put in this.
So now I'm gonna have him. Oh, and I want to also make sure that the legs and arms are moving like equally and appropriately. So arms seem to be moving well. Legs. So I'm gonna have you get up, okay? So I would have him get up, and I would observe his gait, and then I can also play with him. So I watch him play, and here I would want to look for any like age-appropriate things. I can also ask mom what he's kind of doing at his age right now. So for a 2-year-old, they should be able to build about 6 to 7 blocks, start using like utensils, play with other children like parallel play, also start kicking a ball, and then for verbally, he should be saying about 2 words at a time, have a vocab of about 50 words by now, and then should be able to name familiar objects, familiar people. Alright, and how's he doing with that? Any like concerns developmentally? No? Alright, well, that's it for our assessment. You passed, look good. Can I get anything else for you guys? Do you have any questions for me? Alright. Of course, I would look at like the wristband and everything when I first came in. Make sure everything matches up. And it does. Alright. Well, I'll be back, and you guys let me know if you need anything. Thank you.